Did you know that I can live with your heart? Nah, I'm not hitting on you. It's just science!
Where wonders of the world are scientifically explored.
From high above the sky
The deepest depths of the sea.
to the thousand cells of our body.
And how everything is connected to one another.
From my body
To yours, body!
Gene therapy transforms medicine by using genes to treat diseases. Stem cells, with their unique ability to self-renew and transform, plays a vital role to this breakthrough. How does it work? Well, I'm Cedric Pagsulingan, and let's explore the science behind gene therapy and stem cells.
Gene therapy is a revolutionary approach to treating and preventing diseases by directly manipulating genes. It involves inserting healthy genes into a person's cells to replace faulty ones, inactive mutated genes, or introduce new genes to fight disease. The delivery of these genes is often a challenge, requiring sophisticated vectors to carry them into cells. This field holds immense promise, potentially offering an alternative to traditional treatments like drugs and surgery. Stem cells, with their remarkable ability to self-renew and differentiate into specialized cell types, play a crucial role in gene therapy. Hematopoietic stem cells, found in blood, bone marrow, and umbilical cord, are particularly valuable due to their ease of extraction. Stem cells are vital for replacing damaged or worn-out specialized cells, ensuring the body's continued functioning. Stem cells exhibit different levels of potency, which determines their ability to differentiate into various cell types. Totipotent. Cells like the zygote can differentiate into all cell types, including the placenta, yolk sac, and umbilical cord. Multipotent or pluripotent. These cells can become many different cell types, but not all. Bipotent or unipotent. These cells have a limited differentiation potential, often forming only one or two cell types. For example, spermatogeneal stem cells in the testicles are unipotent and can only develop into sperm cells.
Adult stem cells are multipotent, less controversial, and is used in treatments like bone marrow transplant but have limited potential. I am Clarence Reolefio.
Embryonic stem cells are pluripotent cells derived from the early stage embryos, typically at the blastocyst stage. They have the ability to differentiate into any cell type in the body, making them incredibly versatile for research and potential medical therapy. However, their use raises ethical concerns because obtaining them involves the destruction of an embryo. Adult stem cells, also known as somatic stem cells, are differentiated cells found in the various tissues in the body, embryonic development. They are multipotent, meaning they can develop into a limited number of cell types related to their tissue of origin. Adult stem cells play a role in repair and maintenance of tissues. They are generally less controversial than embryonic stem cells and are used in therapies like bone marrow transplant.
Induced pluripotent stem cells represent a groundbreaking advancement in regenerative medicine. In 2006, researchers discovered how to reprogram specialized adult cells back into a stem cell-like state. This reprogramming involves introducing genes that mimic the behavior of embryonic stem cells or ESCs. Like ESCs, iPSCs are pluripotent, meaning they can differentiate into all cell types in the body. This remarkable ability offers immense potential for treating diseases like Parkinson's and Alzheimer's by replacing damaged or diseased cells. While still under development, iPSCs hold the promise of personalized therapies tailored to individual patients, revolutionizing the treatment of numerous debilitating conditions. Umbilical cord stem cells. Umbilical cord stem cells offer a readily available and ethically less controversial alternative to embryonic stem cells. These cells, harvested from the umbilical cord after birth, are multipotent, capable of differentiating into various cell types. The ease of collection and relatively low cost make umbilical cord stem cells an attractive source for regenerative medicine. Donated cord blood is typically frozen and stored in banks for future use, potentially lasting over a decade. This readily accessible source of stem cells holds significant promise for treating a range of diseases and injuries, offering a valuable tool in the ongoing quest to improve human health.
Did you know that surrogacy is when a woman carries and gives birth to a baby for someone else who cannot have a child on their own? I'm Carl Justin Flores, and I'm going to discuss more about surrogacy.
The concept of surrogacy dates back to the ancient times, with references in religious and historical texts. The first recorded modern surrogacy case occurred in 1976 in the United States, when attorney Noel Kian helped arrange a traditional surrogacy contract. This case was successful, leading to more formalized surrogacy agreements. The first gestational surrogacy, it is where the surrogate is not genetically related to the child, was performed in 1985 using in vitro fertilization or IVF. Initial difficulties in surrogacy. Early surrogacy arrangements faced several challenges including, first, legal and ethical concerns. Many countries and states lacked laws regulating surrogacy, leading to disputes over parental rights. Second, social stigma. Surrogacy was initially seen as controversial, with debates over the exploitation of women. Third, medical limitations. IVF technology was still developing, resulting in lower success rates. There are 4 types of surrogacy arrangements. First, traditional surrogacy. The surrogate mother is genetically related to the child, as her own egg is fertilized using sperm from the intended father or a donor. Second, gestational surrogacy. The surrogate carries an embryo created through IVF, using the egg and sperm of the intended parents or donors. The surrogate has no genetic link to the child. Third, altruistic surrogacy. The surrogate is not compensated beyond medical and pregnancy-related expenses. The last one is the commercial surrogacy. The surrogate is financially compensated for carrying the child. Process of selecting a surrogate mother. First, medical and psychological screening, ensuring the surrogate is physically and mentally fit. Second, legal agreements, drafting contracts to protect the rights of all parties. Third, matching with intended parents, based on compatibility, values, and expectations. Fourth, medical procedures, undergoing IVF or artificial insemination. Fifth, monitoring the pregnancy, regular health checkups, and psychological support.
IVF, also known as in vitro fertilization, is a medical procedure that helps individuals and couples overcome infertility. It involves fertilizing an egg with sperm outside the body in a laboratory.
In vitro fertilization, or IVF, is a medical procedure that helps couples conceive a child. The first successful IVF case involved Leslie and John Brown from the UK, with the procedure carried out by Dr. Patrick Steptoe and Dr. Robert Edwards. On July 25, 1978, the world's first test tube baby, Louis Joy Brown, was born at Oldham General Hospital in England. The IVF process consists of several steps. First, ovarian stimulation is performed using fertility drugs to produce multiple eggs. Then, the eggs are retrieved through transvaginal ultrasound aspiration. Meanwhile, sperm is collected and prepared for fertilization. The eggs and sperm are then combined in the lab for fertilization. After fertilization, the fertilized eggs develop in embryo culture for 3 to 5 days. Once they reach a healthy stage, the embryos are transferred to the uterus. A blood test is conducted 10 to 14 days later to confirm pregnancy. Despite its benefits, IVF has some side effects on women. Physically, it can cause bloating, cramping, and breast tenderness. Some women may develop ovarian hyperstimulation syndrome (OHSS), which leads to swollen ovaries and fluid buildup. Emotionally, women undergoing IVF may experience stress, anxiety, and depression. Louis Joy Brown, the first IVF baby, was born via cesarean section on July 25, 1978, in the UK, weighing 5 pounds 12 ounces or 2.6 kilograms. IVF success rates vary by age, with a 40 to 50% success rate for women under 35 and a 5 to 10% rate for women over 40. Several factors influence successes, including egg and sperm quality, uterine health, lifestyle, and the expertise of the clinic.
Did you know that pig heart transplants, also known as Xenotransplantation, involve using a genetically modified pig heart to replace a failing human heart? By the way, I'm Paul Nicholas.
The first pig-to-human heart transplant was performed on January 7, 2022 at the University of Maryland Medical Center by a team led by Dr. Bartley P. Griffith. The recipients, 57 years old David Binet Sr., survived for 2 months post-surgery before passing away on January 8, 2022. Pig hearts are considered for transplantation due to the anatomical and physiological similarities to human hearts. Additionally, pigs are readily available and can be genetically modified to reduce the risk of organ rejection, making them suitable candidates for xenotransplantation. Xenotransplantation refers to the transplantation of living cells, tissues, or organs from one species to another, such as from pigs to humans. This approach aims to address the shortage of human organs available for transplantation. The 2022 transplant demonstrated that a genetically modified pig heart could function in a human body for a limited time. However, the patient's death after 2 months highlighted challenges such as organ rejection and potential complications from latent viruses.
They say that the kidneys are the filter of our soul. Hi, my name is Jarnal Arcutayam and I'll prove they're not wrong.
A kidney transplant is a surgical procedure where a healthy kidney from a donor is placed into a person whose kidneys are no longer functioning properly. This replaces the damaged or failing kidneys. There are 2 main types of kidney transplants: deceased donor transplants and living donor transplants. Deceased donor transplant involves receiving a kidney from someone who has recently passed away and consented to organ donation. Living donor transplants involves receiving a kidney from a living person, often a family member or friend. While living donor transplants offer advantages like a shorter wait time and potential better organ function, deceased donor transplants are more common due to the limited availability of living donors. The first successful kidney transplant took place on December 23, 1954 at Brigham and Women's Hospital in Boston, Massachusetts, led by the team of Dr. Joseph Murray. The recipient was Richard Herrick, a 24-year-old man with chronic kidney disease, and the donor was his identical twin brother, Ronald. It is important to ensure the safety and well-being of both the donor and the recipient when selecting a kidney donor. The process begins with identifying potential donors, and it involves extensive medical evaluations, including blood tests, imaging scans, and psychological assessments. The goal is to determine if the donor is healthy enough to donate a kidney and if their tissue type and blood type are compatible with the recipient. If a direct match is not possible, paired kidney exchanges or the National Kidney Registry can facilitate an appropriate match through a series of transplants. Kidney transplantation carries risks for both the donor and the recipient. For the donor, the surgery itself poses risks like infection, bleeding, and blood clots. Long-term risks include a slight increase in high blood pressure and protein in the urine. For the recipient, the biggest risk is rejection, when the body's immune system attacks the new kidney. This can happen immediately or over time and can lead to kidney damage and failure. Rejection is managed with immunosuppressant drugs, but these drugs can also increase the risk of infection and other side effects.